Well, we can't talk about menopause without talking about hormones and hormone replacement therapy. There are a lot of questions about it. And today we have nurse practitioner Danny Owens and Dr. Kevin Brown with us. They are from Alpha X Omega, and they are going to help us make some sense of the options women have, because there's so much information, misinformation. So thank you both for being here today.
You're welcome.
Dr. Brown, I want to start with you. What is hormone replacement therapy? It's pretty self-explanatory, but there's a lot that goes into it.
There is a lot to go into it. Hormone replacement therapy, we at Alpha X Omega replace female and male hormones, but primarily female hormones. I mean, when a woman goes through menopause, of course, their estrogen and progesterone tank. Sometimes their testosterone does. Yeah. Sometimes the testosterone doesn't, and you get an imbalance, and you'll see women with thinning hair. They retain their muscle mass, but they lose that. If a woman goes through a hysterectomy at a young age, especially an oophorectomy where bilateral ovaries are removed, they go through instant menopause, regardless of age. And I have a patient last week that was 19 years old when she had hers removed.
Oh,
so,
my word.
And they didn't replace her properly. And it makes a world of difference, because it's not a life and death issue, but it's a quality of life issue.
Yeah.
So we try to replace the hormones. A woman comes in for any reason, and we always check thoroughly all their hormone levels, their FSH, FH, TSH.
Yeah.
Their
Everything.
estrogen, progesterone, testosterone free, and everything. And then we balance them out. We bring them back up to what their normal level should be. And it's a life-changing really story.
Yeah, I always say hormones are powerful little things, right?
Yes,
like, you don't pay attention to them until you don't have them, right? And then it kind of throws you off track. So who can this help? You mentioned, obviously, women going through menopause, but a 19-year-old, who benefits from hormone replacement therapy?
Any woman that's hormones are deficient.
Okay.
At any age.
At any age?
At any age. I had an 82-year-old woman come in last week, and an RN.
Okay.
And I looked at her panel and decided we just put her on testosterone because she was going through mental brain fog, fatigue, increased adipose tissue, and we started her on. We're just going to see how she does as a trial.
Okay.
And if it doesn't work, then we'll stop.
You try something else, right? And that's all part of the process at AXO, the way you guys handle things. Danny, I want to talk to you about the process that you guys approach with a patient. It's very customized.
It is. So we always start with a thorough lab panel.
Yeah.
And like you were saying about age, I mean, there's really no age limit. Like, what are your symptoms? Are you feeling bad? Are you gaining weight? Do you have low energy? How's your libido? Things like that. That's when we test. We don't really look at age.
Okay.
But we thoroughly look at thyroid levels, like he said, progesterone, testosterone, estrogen. Where are you at as a whole picture?
Well, and the fact that you don't look at age, because some women go through menopause or they start feeling those symptoms much earlier or later. So the age range is pretty wide. So you can't just zero it in on that.
Correct.
And you talked about it a little bit, why this does matter so much. Women who go through menopause, as we all will if we're lucky enough to live that long, it changes everything. It changes how we feel about everything. You said it's a quality of life issue.
Yeah, and people with diminished hormones can go through anxiety and depression.
Wow.
I actually had a psychiatrist, a patient a while back, and she had hormone deficiency, and all the things she was doing medication-wise for psychiatry weren't working, and we dialed in her estrogen and her testosterone, progesterone, got her okay, right? And since then, she felt so good that when she has a patient that doesn't respond well to her treatment and her medication, she sends it to me, and we dial in their hormones, and then all of a sudden they're back to normal again. They have their life back.
Yeah.
It's incredible.
And it affects every relationship in our world, right? Whether it's with our spouse or our partner, everything.
We've saved marriages.
You've saved marriages. It's a very good thing.
When you go through, menopause, people don't think about that they also lose their testosterone level during that blend too. And then there goes your libido, it just goes in the tank. And so we balance their female hormones, but also add the testosterone back. And be surprised that giving that libido back does change lives. And then I've had women saying, since that worked so well for me, they drag their husbands in.
He's next.
And then we do the men. So we do men too, but it's primarily focused on women.
Yeah, I love it. Well, you're doing a lot of things, helping a lot of people going through these challenges. Thank you so much for being here. We appreciate the information. And they do have a special offer for our viewers today. Mention Sonoran Living and get a free consultation, which is a $50 value. Slimming Grace Alpha X Omega is located up in Kingman. If you'd like more information, scan the QR code, visit their website, or call 928-263-1481.